Okay, so if you can write the title, X-rays in medicine. So what we are looking at today is to understand how X-rays are used in medicine. So state what X-rays can be used for in medicine. Describe the factors that affect the radiation doses received by people. Describe the operation of an X-ray machine. Explain in detail how various safety features reduce exposure to ionising radiation, and then evaluate the doses of ionising radiation received in a variety of occupations or medical treatments. Okay, so just a reminder of frequency and energy relationship. So remember, the frequency is how many of the waves there are. So over this side where the gamma radiation is the highest frequency. Over this side where radio waves are is the lowest frequency. So the relationship is we've got a low frequency and a low energy, high frequency, high energy, and this is where our X-rays are, so nearer the sort of high frequency end of the electromagnetic spectrum. Right, so X-rays in hospitals. An X-ray is a quick and painless procedure commonly used to produce images of inside of the body. It's a very effective way at looking at bones and can be used to help to detect a range of conditions. So X-rays are usually carried out at hospitals in X-ray departments by trained specialists called radiographers, although they can be done by other healthcare professionals such as dentists. So how are they produced? So this is just a bit of recap from last lesson. So X-rays are produced in a tube when fast-moving electrons hit a metal target. X-rays are then directed at a patient and can pass through the patient's body. They can pass through soft tissue but are absorbed by bones, teeth and metal objects. The part X-rays pass through are dark, and so the bones appear lighter because that's where it's absorbing the X-ray. So obviously they're going to aim that X-ray at the area of the body that they think maybe has got potential damage to it. So X-ray machines. And X-ray machines use a very high potential difference, the voltage, which is dangerous. So using a relay that pulls two magnetic switches together, this allows a low potential difference to operate a switch in the high potential difference circuit. So it's making it safer. So we've got our low voltage, okay, which has got a switch in there, and we've got our high voltage circuit. So if we switch on our low voltage, then the current flows. That then makes the electromagnet in sort of this area here, okay, create a magnetic field, which switches the magnetic, pushes that circuit together and creates the circuit in the X-ray machine. So it allows the current to flow and take a picture. So that's how they actually work inside those X-ray machines. If we open the switch, current in the low voltage circuit no longer flows, that magnetic field stops, the iron switch is open, so it stops the current in the X-ray machine itself. Okay, so detecting X-rays. A flat panel detector is a small screen that contains a charged coupled device, something that we learnt about in a few lessons ago. So the sensors in the charged coupled device converts the X-rays to light. The light rays then create electronic signals in the sensors that are sent to a computer, which then is going to display that image of the X-ray. Okay, so we've got X-ray machines stopping the X-rays. Lead plates between the tubes and the patient stop X-rays reaching other parts of the body. So remember, X-rays can penetrate most things, but not something that's really dense like lead. So the lead plates are adjustable, depending on what parts of the body need to be X-rayed. Lead is a good absorber of X-rays, and the X-ray can pass through the gap between those plates that are there. And the exposure from one X-ray picture is for less than a second, which limits the dosage, because we don't want to have too high a dosage of the X-rays. Okay, so quick question check here, so you can pause the video and answer those two questions. So who takes X-rays in hospitals? It is trained specialists called radiographers, and you can have dentists as well. How are X-rays produced? From fast moving electrons hitting a metal target, and the X-rays are then directed towards the patient. Have a go at this next question. Pause the video now. Okay, so describe the operation of an X-ray machine. So X-rays are produced from fast moving electrons hitting the metal target. Because of the high voltage needed to generate X-rays, a low voltage circuit is used to close a relay switch attached to a high voltage circuit, which allows the X-ray to be generated. Sensors in a charge coupled device convert the X-rays to light, and then the light rays are detected by the charge coupled device, which creates a digital image. Those adjustable lead plates allow the X-ray beam to be direct to the area of interest of that patient. The plates are made of lead to stop the X-rays going to other parts of the patient's body. The patient is exposed for less than a second to those X-rays. Okay, X-rays and medical usage then. So the X-ray frequency range is from 3 times 10 to the power of 16 Hertz to 3 times 10 to the power of 19 Hertz. So if we have a look then, we've got imaging. So we're looking at the bones there to see if there's any damage. Soft tissue diagnosis. So again, in certain tissues we can have a look at them, not just bones. And also in cancer therapy. So X-ray imaging then. So low energy X-rays are suitable for imaging because they are absorbed by bones and teeth, but they pass through soft tissues and gaps such as cracks in the bones. Low energy X-rays don't carry enough energy to destroy cancerous tumours. So for X-ray imaging absorption, this is a cross section of a tibia and fibula. X-ray beams sort of going through, and if you notice there, the intensity has changed. So there's the beam look of how it was, and it's changed as it's gone through those bones. If we have a look at what's happened to the intensity of the wave. So the X-ray image effect from the signal would change as well. So you can see here where it's gone straight through, or mainly gone straight through, it's black going to a little sort of lighter shades of grey. Where it's sort of changed there, obviously it's going to be absorbed slightly because not all of it has gone through, and we've got a white image. Okay, grey again where some of it's been absorbed, not all of it. This area, okay, a lot of the wave's been absorbed, so therefore it's white. Okay, and again, little bits on this side have been absorbed, so you can see grey, and none of it's been absorbed, it's all passed through where it is white. So that's how we're getting those different colours on the X-ray, and that's what you can see there. So the X-rays are absorbed by human tissues, not reflected. Right, so detecting soft tissues with X-rays. Normally, soft tissue is difficult to detect even on a low energy X-ray. So an organ that consists of tissue can be filled with a substance called a contrast medium, and that will absorb the X-rays easily. So this enables the internal surfaces in the organ to be seen by the radiograph. So the patient is given a barium meal, so something that's got barium in it, before the X-ray. Barium is a good absorber of low energy X-rays. So it means that it's going to show up, so wherever the barium's moving to, it's going to show up in that X-ray. Okay, Xray therapy, so a type of radiation therapy that uses high energy radiation, so from sort of the higher frequency end of the X-rays, to kill cancer cells and to shrink tumours. So thick plates between the X-ray tube and the body stop them from reaching the healthy body tissue. So we're just trying to get it onto, obviously, those cancerous areas. X-rays for therapy are shorter wavelengths of higher frequency than those used for imaging, so when you've got a broken bone, and this means they carry much more of the energy. Okay, so if you can pause the video now and have a go at those 3 questions. Okay, so what is the frequency of X-rays? It is 3 times 10 to the power of 16 Hertz to 3 times 10 to the power of 19 Hertz. State what X-rays can be used for in medicine. So it could be for imaging, soft tissue diagnostics and cancer therapy. What happens to X-rays as they pass through the different tissues in the human body? X-rays are absorbed by human tissue, especially bones and teeth. Have a go at this next question. Pause the video now. Okay, so describe the factors that affect the radiation doses received by people in the different types of X-rays for medicine. So imaging is low energy X-rays because they're absorbed by bones and teeth, but they pass through the soft tissue and gaps such as cracks in the bones. So it enables us to see if there is any damage there. Soft tissue diagnostic uses barium because it is a good absorber of low energy X-rays. So the tissues wouldn't normally absorb them and show up on the imaging, but if you ingest that barium, then they will. Therapy uses high energy radiation from X-rays to kill cancer cells and to shrink tumours. Okay, so radiation dose. X-rays, as well as alpha and beta and gamma, ionise substances they pass through. So we're going to learn about alpha, beta and gamma in another topic sort of later on this year. These ionising types of radiation are dangerous. So the radiation dose is a measure of the damage done to the body by ionising radiation. So remember what we talked about at last lesson. So ionising, it's basically saying that the electrons are being taken away from the atom, and then the atom is becoming charged, becoming ionised. So this depends on the type of radiation used, how long the exposure is to the radiation, and the energy per second absorbed by the body. So stopping X-rays. So lead is put into walls, panels and screens to stop the X-rays reaching the radiographer or operator. So if you've ever been for an X-ray before, you've probably seen one of these areas within the room, and that is what the medical staff will go and stand behind. So the further away, the thinner thickness of lead needs to be. Generally, 1.5 millimetre is used at a distance over 2 metres from the hospital X-ray source. So personal protection as well. So when medical staff can't use protective rooms or booths, then lead-lined aprons and jackets need to be used so they can look after the patients. Now I can remember that I had to go in for an X-ray with my daughter when she was a young child. I think she was only sort of a year old. So she wouldn't have been able to stay on the bed herself. I needed to hold her on, and I needed to hold sort of her legs still, which is where she was having the X-rays taken. I had to wear one of those lead-lined aprons because I obviously couldn't go and stand in the booth. So that would have protected my body from any of the X-rays that were meant to be passing to check to see of any damage to my daughter's bones. So a reminder, safety matters. So we did this last time. So people who use equipment or substances that produce any form of ionising radiation must wear a film badge. If the badge shows that is overexposed to ionising radiation, then the wearer is not allowed to continue working with the equipment for a period of time. So monitoring then how much radiation. The badge can show the different types of radiation exposure by shielding, so different film and different windows. So for example, alpha radiation stopped by a thin sheet of paper Beta is stopped by a few millimetres of metal, and then obviously your gamma is stopped by a thicker piece of lead. Okay, so I'd like to pause the video now and have a go at this question. Right, so explain in detail how various safety features reduce exposure to ionising radiation for people working in the medical profession. So you should have said ionising radiation such as X-rays kills or damages living cells. Lead can effectively reduce or stop most kinds of ionising radiation because it's got a high density and a high atomic number. Lead is used in aprons, shields and walls. The closer the operator to the X-ray, the more powerful the X-ray source, so the thicker the lead would need to be. So 1.5 millimetre at 2 metres from the hospital X-ray equipment. A film badge can monitor the amount and type of radiation a wearer has been exposed to and be used to limit the person's exposure. So lead's not radioactive, other metals are more dense but radioactive. So you could, if you were to use those other metals, obviously they're radioactive as well, so they would be releasing that radiation, but lead isn't, so that's why it's used. Okay, so that is the end of this lesson. If you have any extra time left, then you can answer the questions on your communications worksheet that you have inside your books, and stick those into your books, and we will go through the answers next time.